Hello, my name's Casey Duncan, and I'm a radiation oncologist with Cancer Care Specialists of Illinois, and I serve patients at Crossroads Cancer Center in Effingham. I completed my bachelor's degree in computer science while serving in the United States Air Force and graduated from the Military Medical School in Washington, D.C. After completing residency training in family medicine, I cared for the men and women serving our country both in the United States and overseas. While I was deployed to Kuwait, my father was diagnosed with lung cancer that had gone to his brain and liver. When I came home to care for him, I met his radiation oncologist and learned about this field of medicine for the first time. A radiation oncologist is a physician who is trained to use radiation to cure and to control cancer. Although my dad's cancer was incurable, his radiation treatments gave us 6 months of great quality time together before he passed away. That experience led me to complete another residency in radiation oncology. It was one of the best decisions I've ever made. Since then, I've worked in the military's largest hospitals taking care of patients with cancer. I retired from the Air Force in 2015, and since then I've had the honor and privilege of working in Effingham and caring for our patients from central and southern Illinois. You can expect your radiation treatment in Effingham to meet the highest standard of care, just like you'd receive at a huge cancer hospital like MD Anderson Cancer Center in Houston, Texas. In fact, your cancer doctors at Crossroads Cancer Center in Effingham were recently inducted into the MD Anderson Physician Network as participating physicians after MD Anderson conducted an exhaustive review of our practice and the quality of care we deliver. As participating physicians, we have a direct line to leading experts in cancer research and care anytime we need it. You and I will work together to determine the best treatment for your cancer and to tackle together any challenges that arise as you receive your treatment. My staff and I will be available to address any questions or concerns you have at any time, before treatment begins, while you're receiving treatments, and after your course of radiotherapy is complete. We, by that I mean you and your team here at Crossroads Cancer Center, are in this together. Since I became a physician more than 20 years ago, cancer treatment has evolved dramatically as a result of advances through research. We are now able to customize treatment for you based on the unique features of your cancer and your own biology. This allows us to provide more effective treatment and to minimize the side effects of therapy at the same time. Research has also allowed us to deliver radiation treatments in fewer days with the same or better cure rates and with no increase in side effects. Research is important because it allows us to improve the care we provide by studying in a very organized fashion the results of new therapies in a careful and controlled way. From the time I was in medical school, I participated in clinical trials to advance our understanding of medicine in general and the treatment of cancer in particular. Clinical trials involve the comparison of a standard type of treatment with a new treatment that has been shown to be safe. This allows us to determine whether the new treatment is actually better than the standard treatment. When that happens, the new treatment becomes the standard of care. Another advance is stereotactic body radiotherapy, or SBRT. This is a kind of treatment for cancer in the lung and some other sites that allows us to focus the radiation beam very carefully and very precisely right on the tumor. That allows us to protect the surrounding tissues and still cure the cancer. My proudest moment working with patients with cancer and their families is the relief I see on their faces after we discuss the details of their diagnosis and decide how we're going to attack their cancer together. Once they know my team and I will be with them every step of the way, battling their cancer, I feel very proud to be their doctor.